Good afternoon, class. My name is Beyonce Griffin, and my research professor is Dr. Winnington. And my research project is on narrowband imaging in PET/CT scanning in the esophageal cancer. Which one is more quicker of picking up early stages of cancer? So, what is esophageal cancer? Esophageal cancer occurs in the cells that line inside the esophagus, which is a long hollow tube which runs from your throat to your stomach. Smoking and poorly controlled acid reflux are the risk factors. NBI imaging is used to detect early stages of cancer, and it's satisfactory with biopsy pathology. It's used mainly on head and neck cancer. So head and neck cancer is a group of cancers of the mouth, sinuses, nose, or throat, which comes from smoking as well, and is mainly used on secondary primary cancer. And secondary primary cancer occurs in a person who has cancer in the past, which may occur from months, years after primary cancer. Secondary primary cancer of the esophagus is frequent in head and neck patients, especially in high-risk populations with great impact or prognosis. PET and CT scanning is mostly used in HNC patients. However, narrowband imaging is more accurate for the technique for esophageal examination. So, in this research project, we are trying to see which one is aimed to be better of detecting cancer at its early ages. Is it PET/CT scanning or narrowband imaging? And how narrowband imaging works is this image shows right here that the blue and green light highlights the abnormal neoplastic vasculature based on the hemoglobin wavelength. Okay. Head and neck is approximately 3.7% of all cancers and 2.4% of all cancers related in the United States, both sexes. However, this is mostly tested on people in Taiwan because there's more people of this risk factor in that country. However, the US only tests people who have a high risk factor of HNC or secondary primary cancer or esophageal cancer. Secondary primary cancer is in the respiratory and gastrointestinal tract, which develops about 7.4 to 51.5% of head and neck patients. Those who have cancer have a high risk of secondary primary cancer because secondary primary cancer only affects people who had cancer before. And the endoscopy with NBI is one of the most virtual chromal endoscopic. And here's a picture of the PET scan. So the methods are that all head and neck cancer patients who underwent the PET/CT scan of narrowband imaging at Taiwan, and all patients have to present written information before the endoscopy examination. The present retrospective study enrolled new patients of HNC who underwent PET/CT and NBI. So before this testing happens, an ESCC was performed to get a submucosa discretion. And how you get this submucosa secretion is they do an overnight fast, and after that overnight fast, you have to take Simdicone, which is an over-counter drug that treats symptoms of gas, which may include painful pressure, fullness, and bloating. It works by changing the surface of the tension of gas bubbles in the stomach and intestines. And it's followed by a pharyngeal anesthesia with 10% Exocline spray. But the first thing that they do is examine the esophagus from esophageal junction repeated to distal to proximal. Okay. The first report comparison of the use of modalities of head and neck cancer patients. Our major findings reveal that the PET/CT scan MBI endoscopy was superior. It was 97% sensitivity, 94% specific for detecting esophageal cancer in HNC patients. And another study, MBI yielded satisfactory sensitivity and specificity for diagnosing. The use of MBI was more covalent and can prevent potential harms. And the limited resolution PET/CT scan was likely primary cause of this ESCC. The treatment strategy was purported and basically said that the risk of oral cancer such as head and neck cancer and esophageal cancer was big amongst Asian population. And a systematic review reported global peptic ulcer disease was approximately 0.12 to 47%. And these results right here, it shows why MBI is more significant for testing. Like you can see right here, it says MBI is 100% sensitivity, while PET/CT is 50% sensitivity. And that's for the ESCC. While suspicious esophageal lesions, it shows that it's more the comparison of MBI with PET/CT scan shows that MBI is more sensitive and specific with the testing results. So it says right here that 798 records of MBI procedures were identified from the database in Taiwan in 2015 to 2018. Consumptions of alcohol and cigarettes were prohibited in the subjects with percentages of 74%, 80%, and 89%. According to American Joint Committee on Cancer 7th edition staging system, 20 subjects were characterized as 122. 14% were stage 2, 16% were stage 3, 91 to 60.90% were stage 4, and 4 7.72%. In these two graphs, you can see the dotted line MBI is more specific to the esophageal lesions, while PT/CT is not as specific as MBI. And the same thing with AUC. MBI shows it's more specific, while PET/CT scanning is not as specific. In conclusion, the high incidence and great prognostic impact of the SPC and the esophagus in HNC patients, PET/CT scan alone may be insufficient for staging workup for HNC, making MBI more superior than PET/CT because of the sensitivity and and how specific it is. Here are my resources and any questions.